Have you been battling with urinary tract infection? Like you keep going back and forth? Yes, it keeps going and coming. Despite taking medication, it goes away. Yes, you get better. After some times, it resurfaces, leaving you troubled. Of course, it is something to be worried about. And then you keep asking yourself, what could the problem be? Or what is it that you are doing wrong? Well, not to worry. In today's video, we are going to discuss 4 possible reasons why this infection keeps coming back. Welcome to Feminine Touch. Thank you for clicking on this video. So, the number one reason why your infection may resurface is you not taking the right medication. You know, each bacteria have a specific antibiotic that works for it. But what most women do is that they engage in self-medication. Yes, they indulge in self-medication. You know, most of these drugs are sold over the counter. So once these women notice that they have an infection, all they do is just walk into any pharmacy and then get any antibiotic of their choice, and then they start treating this infection themselves, which is very, very wrong. The ideal thing to do is for you to visit a hospital and undergo series of tests such as urine, swab, and possibly blood. Your doctor will be able to ascertain the bacteria that is causing your infection. That way, he will be able to prescribe the antibiotic that will kill such bacteria. All you need to do is just to ensure that you take this medication as prescribed by your doctor to avoid these infections coming back. Number two, do you know that overusing these antibiotics can make the bacteria to become more resistant? Yes, it can make the bacteria to become more and more used to that antibiotic. So, what most women do is that once they start taking this medication, they get better, and then maybe after some time this infection resurfaces. Instead of them going back to their doctor to explain to him that, look, oh, this infection is back again, they feel so reluctant, and all they do is that they go back to the pharmacy. Yes, they go over the counter. They will be like, is it not this drug I just finished taking? Shebi, I know the name, I know the dosage. So they just go over the counter, get that same drug, and then they start the same treatment. So these bacteria over time become used to that antibiotic, and they keep doing that repeatedly. So over time, this bacteria becomes used to that antibiotic. Yes, the bacteria, something like see finish. Yes, the bacteria don't see the antibiotic finish. So it becomes resistant, rendering that antibiotic ineffective. So the ideal thing to do in this situation is once you complete treatment and you notice that this infection resurfaces, all you need to do is go back to your doctor so that he may consider changing your antibiotic. These germs, they grow and they spread. So to avoid them spreading to other areas that may cause more serious complications. And that way, your doctor also will be able to examine you if your symptoms is as a result of something else other than urinary tract infection. So that is another reason why your infection may keep coming back. When these bacteria get used to a particular antibiotic, yes, they become resistant to that particular drug. Number three, you know we are all created differently. Yes, each of us have their own unique features. So there are women who right from birth were born with an abnormal shaped urinary tract. So this leaves them more prone to infection. And then number four, and the final one, there's also a possibility of reinfection from your partner. Okay, you have this infection and then you start treatment. Your partner doesn't have the infection. But do you know there's a possibility of you passing this infection to your partner? Yes, there's every possibility. Reason being that you both engage in intimacy, you keep engaging in intercourse. So there's this possibility that you can pass that infection to your partner. So as you're taking this medication, you don't take it alone. Yes, you don't take that medication alone. Ensure that your partner also take that medication with you. This is because if your partner doesn't take that medication, I know some of these men are stubborn. So ensure that you encourage them. Yes, encourage him to take the medication along with you. Because if he doesn't take that drug, there's every possibility that he will reinfect you back. Yes. So it's more like a waste of time, a waste of resources, a waste of energy. Because as you're treating yourself, your partner is not treating himself. So the more you're treating yourself, the more he's reinfecting you. So it doesn't make any sense. So just ensure that you encourage him to take that medication with you so that, the cycle will continue. You're taking the drug. He's not treating himself. He keeps reinfecting you.